اولا اعتذر عن التكنيكال بروبلمز يعني in the era of corona زي ما يقولوا anything is expected. فالامور كانت مرتبه من امس في البلاك بورد لكن something happened. So we had to start from the start. طيب الان موجودين معي حوالي 27 طالب، والدفعه فيها حوالي 33 حسب ما الليسته اللي جاتني. فيبقى ستيل
اصبر عليهم 5 دقائق يا دكتور.
ايوه في تقريبا حوالي 5 طلاب الى الان لسه ما موجودين. هم قريبين ولا بعيدين ولا ايش وضعهم؟
زحمه يا دكتور، بس اصبر عليهم 5 دقائق وابدا. الاتندنس 30 دقيقه بس.
اوكي
الو السلام عليكم.
وعليكم السلام ورحمه الله وبركاته.
عبد الحربي كيف؟
Who's moving the slides? I have to be the only moderator in this session. Huh?
الله يديم الضحكه يا دكتور.
طيب يا شباب بسم الله الرحمن الرحيم. I would like to apologize again for this technical problem that we have experienced in this morning. We are supposed to start at 8. Now we are almost 1 hour and 10 minutes past the indicated time. So sorry again for this technical problem. This session, do you hear me well, please? Do you hear me well?
نسمعك ممتاز يا دكتور، ممتاز جدا.
Okay, that's fine. So uh, إذا كان صوتي فيه مشكلة maybe
دكتور صوتك مرة ضعيف دكتور، صوتك ما يسمع،
قرب
ضعيف.
خليني
المايك
أرفع
بس يا
الصوت
دكتور شوي.
to the maximum. طيب now volume is maximum تقريبا. Okay. اوكي كيف الان طيب؟
انا بالنسبه لي
واضح
ممتاز. يا
الان
شباب ايش رايكم؟
شباب؟
يا شباب اكتبوا بالشات ايش رايكم يا شباب؟
ممتاز واضح الصوت.
طيب okay طيب ممتاز. طيب this session is going to be about the introduction and orientation to the surgery 1 course. You know this course is now being taught in its new version. يعني هذه السنة الثانية في صورته الجديدة بعد ما تم تحديثه من الطريقة القديمة. it has been attempted last year وهذه السنة الثانية في النظام الجديد. The objective of this session is to give you details about what's going to happen in this course. So I think it's very important session because it will tell you what's going to happen and it's going to set your expectations from the start to the end of the session. What do you need to do? What teaching activities you would experience? Where you will go to learn? Hospitals, whether in the college, what is the assessment, what is the group distribution, what is the timetable. So we'll talk about all the things, and I hope by the end of this session, most of the, if not most of the questions in your mind will be answered. Okay. So please listen to me carefully. Give me some time to explain myself and my ideas, and then, however, you can stop me at any point if you have any question. Okay. What are we going to cover in this session? We will talk about the course content and learning outcomes. These are very important. You should know very well and exactly what learning outcomes are required from you. What you should be able to do by the end of the course. This is important for your learning and also important for the assessment. Okay. We'll talk about the module timetable, the organization of the module, activities, teaching activities, where they will take place, and the schedules and so on. And then we'll talk about the students group distribution, which are required for the timetable and required for the portfolio activity. And then we'll talk about the assessment in both formats, formative and summative, distribution of marks, how many marks will be assigned for each part of the assessment. And then we'll go to talk about the course portfolio, which has been created last year in order to foster student learning. You know, portfolios are used in in medical education nowadays very frequently. They have got many advantages. We'll talk about that later, inshallah. We'll talk about the course study guide. What does it contain? How does it help you to learn? And then we will finish by the attendance forms and the attendance rules and guidelines as applied in the college. Okay. So these are the points which I will cover in this session. If you would like to add any point, then you can do that by the end of the session. So first of all, what are the learning outcomes? First of all, let me give you a brief introduction about what has been done in the course in comparison to the past years. In past years, we used to teach, or my colleagues or the people who were there, they used to teach the clinical presentation of disease, and they used also to go into some details of investigations and management, like treatment plans, what type of surgery we do for surgical to treat patients and so on. Nowadays, in this new form, we have made a reform to the course as a whole, in which we will going to concentrate mainly on the clinical features of diseases. So we'll talk about the symptoms of the surgical diseases. We'll talk about the signs of these diseases, how to take history, how to reach a differential diagnosis, how do you defend your differential diagnosis. Okay. what is the most likely diagnosis, things like that. So the whole thing will be around the clinical features of the disease. Okay. And for instance, in this course, we will not go into so much details, or I can say we are not going into many details of the investigations or the management. We will leave that when we come again to study surgery in the 6th year. Okay. If you have an idea about the spiral design of curriculum, I don't know whether you have an idea about that. Have any of you heard of that spiral curriculum design? You have any idea about that? Do you hear me, please?
Yes, we hear you, doctor.
Do you have an idea about the spiral design of the curricula? Uh, yeah, spiral curriculum is just like a spiral, like a spiral. You visit a course at one time during your study from one perspective, and then when you go to higher level of study, you revisit the course again, but at that time you study other perspectives of the same topic. This is what we'll do in this year. In that, at this time, we'll concentrate on the clinical features, okay, mainly of the disease. And when we come in the 6th year for surgery 2, then at that time we'll go into more details of the investigations and management. Okay, is that clear?
Yes, clear, doctor. Clear.
Okay. Yes. Okay. So now, what are the learning outcomes? What are the abilities? What are the things which we expect you to be able to do by the end of this course? First of all, you should let me go to the previous slide. Sorry. Yes, from here. You should be able to describe and explain the clinical features of the common surgical conditions as outlined in the course study. So at least, for example, you should be able to tell what are the clinical features, for example, of acute appendicitis, that the patient comes with right iliac fossa pain, mild fever, anorexia, and so on. What are the symptoms of common surgical diseases as outlined in the study guide, okay? The other learning outcome that you should be able to explain the pathophysiological concepts underpinning the clinical features. For example, in obstructive jaundice, we know that patients they can present with bleeding tendency, and we know that is due to failure of absorption, for example, of vitamin K from the intestine, for example. Okay, or a patient with head injury, for example, can present with high blood pressure and bradycardia, and the explanation of that can be due to the power receptors and the vasomotor center in the brain, for example. Okay, so each symptoms might have underpinning pathophysiological features which are related to the basic science. So where appropriate, you should know about these pathophysiological backgrounds of these symptoms and signs. Now, if you get a number of symptoms and signs, I mean a clinical presentation or different clinical presentation of more than one disease, then you should be able to compare and contrast signs and symptoms of these conditions to tell what is the most likely diagnosis. For example, a patient who have got acute appendicitis and who have another patient who have got urinary colic, they can present with more or less same features. Okay, so you should be able to differentiate clinically before investigations. Clinically, what is the most likely diagnosis? Is it acute appendicitis or is it urinary colic? Why? For example, here you get high fever, here you get low fever, here you get dysuria, here there is no dysuria. Okay, so you should be able to evaluate these symptoms and signs and tell what is the most likely diagnosis. All of this is just based on your clinical knowledge before going into investigations and so on. So you should be able to compare and contrast based on your clinical knowledge between the important clinical presentations. Number 4, you should be able to develop and defend a legitimate list of differential diagnoses. When you present a case, at the end of the case, they will ask you, what is the give me a reasonable list of possible causes, which we call also differential diagnosis. Okay, so for example, a patient who came with right iliac fossa pain, if she is a lady, you can say this is it could be acute appendicitis. It could be, for example, urinary colic, or it could be something related to gynecological causes, like, for example, salpingitis or ovarian cyst or whatever. Okay, so you should be able to develop that list of possible causes, and then if they ask you what is the most likely one, what do you think what is the most likely one? For example, you can say this acute appendicitis because the pain is like that, and the patient have got other symptoms which are subject to acute appendicitis, and at the same time does not go with gynecological causes. Okay, this is how you can develop and defend yourself, and all of this is based on your clinical knowledge. Okay, this is only clinical evaluation without talking about details of investigations and management and so on. As you can see, from 1 to 4, these are mainly cognitive skills. Number 5 is mainly a psychomotor one, in which you should be able to take history. You know, the process of diagnosing disease start by asking the patient about his symptoms. This process is known as history taking, and in the next lecture you will be addressed about how to take history, what is the format of history taking, and what is the most method of history taking. Number 6, you should be able to conduct systematic physical examination. Excuse me, you can't hear me well. Someone is saying that there's a background noise or something like that. Maybe due to the net, maybe due to the internet connection. I'm not sure. I'm just putting the microphone in my mouth, you know. Okay, we will try and we will see, inshallah. So you should be able to conduct a systematic physical examination to elicit signs of common cervical conditions. I think you have been introduced maybe in the third or second year to the principles of physical examination. I think you have been taught how to do abdominal examination, for example. Okay, so this is what we are going to do, but this time in more details. I'm focusing in cervical patients. So how do you examine, for example, a hernia? How do you examine, for example, an ulcer? How do you examine a subcutaneous lump? How do you examine, for example, the abdomen, and so on? So this is one of the skills that you should learn at this stage of your studies. Number 7, you should be able to outline the indications, precautions, methods, and complications of basic surgical and bedside procedures as indicated in the course study guide. One of the skills that we will go through is some procedures. You will learn some procedures, like, for example, Foley catheter insertion, for example, digital rectal examination, for example, how to suture a wound, okay, how to scrub, for example, how to follow the precautions of hygiene and standard precautions, things like that. We will give you introduction about that. You should know the indications for these procedures, the precautions, the method of performing that procedure, and so on. So you have to have some knowledge of these procedures, okay, like the indications, some complications which might happen, and so on. And then you should be able to perform these basic surgical and bedside procedures as indicated in the course study guide, like, for example, insertion of Foley catheter, or insertion of an NG tube, or insertion of a chest tube. Okay, we will demonstrate you how do you do that, and then we will ask you to perform or to practice in the simulation center how to perform these procedures. Okay, so we expect you to be able to do that by the end of this course, but at least if you are not able to do it, at least we expect you to be able to describe how do you do it. Is that clear? Just to be more flexible. Number 9, the last one is communicate. You should communicate with patients and peers and attain the basic principles of professional medical practice. Now, these professional standards of ethical standards of medical care are very important nowadays. Okay, you should be very attentive in observing these principles of professional practice. We'll introduce you to this practice. How do you communicate with patients, to take history for them? How do you get permission from patients to examine them? When do you approach them? What do you do if they refuse to be examined or refuse to give history? like that. Okay. Please don't move the slides, please. So we will introduce you to this basic communication skills. We will assess them not in detail, but at least we will partially assess this. Okay. So regarding the learning outcomes, are these clear, please? Regarding the learning outcomes, are these clear? Okay. Yes, so I will just give you an example to explain what is required from you. If you interview a patient and he told you that my complaints are those of abdominal pain, vomiting, and absolute constipation. Abdominal pain, vomiting, and absolute constipation. What does this make sense to you? Like it can go with the intestinal obstruction to me. Basically, at the very beginning, I would think of, for example, intestinal obstruction. However, there could be other causes which can lead to abdominal pain, vomiting, and constipation, like, for example, pancreatitis, like, for example, severe cholecystitis, intra-abdominal infection. They can give rise to such infection. Okay. So at the very beginning, you will put that test in your mind. Then you go to examine the after you finish your history, you go to examine the patient. So you may ask yourself, what do I expect in the physical examination? If this is intestinal obstruction, then I would expect the patient to have a distended abdomen, for example, or he could be having a visible peristalsis, or he might also have exaggerated bowel sounds and so on. Okay, so if he found that the patient who have these symptoms have also these signs, then the diagnosis of acute obstruction will be more likely if he had these symptoms and these signs. If they ask you to develop a differential diagnosis, then you could see the condition which you thought of at the beginning, like as I mentioned, pancreatitis, intestinal obstruction, cholecystitis, for example, intra-abdominal abscess or infection like so. If they ask you what is the most likely diagnosis, you say, I think this is most likely intestinal obstruction. If they say you why, so they need you to defend yourself. You could say that all the cardinal features of rhythm endocytosis are there, like abdominal pain, vomiting, and constipation. And the patient have got also distended abdomen. He has visible peristalsis, and his bowel sounds were exaggerated. This clinical picture is most likely that of intestinal obstruction. So you can see now in this process, you compare and contrast. You judge on the most likely diagnosis. You put a list of differential possible causes in your mind, and then you can provide at the end the most likely diagnosis. So this is just a brief exercise to summarize the learning outcome that we have just discussed. Okay. So that was about the learning outcomes. If you have got any question, please talk to me. I will prefer you to talk to me, please, if you have any question regarding the learning outcomes. Before we move to the second point.
اللي عنده سؤال يا شباب فيما يخص الموضوع الماضي. طيب يا دكتور، في عندي سؤال انا اذا تسمح لي. فيما يخص الدكتور موضوع انا وش اللي راح يصير في موضوع البراكتيكال، وش الليرنينج اوت كم في البراكتيكال والاوسكي؟ The same من اي ناحيه؟ هل في ريفرنس، هل في محاضرات يعني؟
في lectures will give you cognitive parts. Okay, clinical sessions will give you the psychomotor skills. And in the lecture we'll be introduced to the theory of the clinical condition regarding the features of presentation, symptoms, and signs, and so on. And in the bedside, you examine, for example, illicit signs, okay, and then you take history like that. So the abilities are actually distributed. Some of them they will taught by lectures, others will be taught by the bedside clinical teaching.
هل البراكتيكال هل practically support by reference or slides?
Yes, we have references. I will talk about references at the end of the session, inshallah.
دكتور عندي سؤال بس إذا سمحت يعني.
Yes, yes.
في البيت سايت الديستريبيوشن حق الجروبس مثلا جروب شاف حالة وحنا الجروب الثاني ما شاف الحالة.
Okay.
طيب كيف يكون التوفيق يعني؟ هل مثلا الجروب هذا يروح يشوف الحالة مرة ثانية يعني من بكرة ولا كيف؟
Yes. يعني شوف أي case you see, even if you think your case is repeating, you learn something new. تمام. Sometimes you think إنه ده appendicitis لكن appendicitis itself مع إنها هي single disease لكن it can present in many ways. And sometimes the pain might start in the right ear. Sometimes in other patient the pain might start around the umbilicus. Okay. فهذه الاشياء هذه بتعطيك ادفانتج انك تشوف السنجل برزنتيشن من ديفرنت برسبكتيفز. تمام. ما فيها مشكله يعني حتى من ناحيه سكيل اوف هيستوري تيكينج اند فيزيكال اكزامينيشن هو مكسب بالنسبه لك. تمام. فما في ما يمنع. بس المشكله الوحيده اذا كان البيشنت اجيتيتد. بعض البيشنتس ما يقبل انه يشوفوا الطلاب ويجوا تشوفوا مجموعه ثانيه. طبعا المريض من حقه انه يرفض طبعا. هذا شيء من حقه. تمام. فاذا رفض هذا شيء ثاني. اما اذا المريض موافق ما عنده مانع في انه بي سين فما في مشكله. حتى لو شافته اكبر مجموعه من الطلاب هذا شيء كويس. تمام. الفكره عموما انك انت بتحاول يباري الكيسز. فهمت علي كيف؟ يعني انت بتحاول كل مره تشوف كيس مختلف من المره الثانيه. مثلا المره هذه شفت انسان سوشن، المره الجايه حاول شوف مثلا دايبيتك فوت. شفت دايبيتك فوت المره الجايه حاول شوف مثلا بريست كيس. يا حبذا لو لقيت مثلا ثايرويد. فكل مره تحاول تنوع الكيس. لكن بعض الاشكالات اللي بتواجهنا انه بيكون عدد الحالات محدود. تمام. ففي هذه الحاله طبعا مضطرين نشتغل في هذه السيركمستانس بانه نحاول نستفيد بقدر الامكان من الشيء الموجود حتى لو اضطرينا نشوف الكيس اكثر من مره. اوكي.
اوكي تمام. يعطيك العافيه دكتور.
شكرا لك يا دكتور، اجابه كافيه وشافيه.
Another question يا شباب. طيب if there are no more questions then let us to move to the second point اللي هي الموديول timetable. طبعا الموديول timetable is important because it tells you about the schedule where you will go and at which time you go and to do what. Okay. So a module timetable actually contains many activities, many teaching activities like simulation, team-based learning sessions, bedside teaching, and so on. And I will just show you the module timetable which has been set for this year, although it's not yet finalized. Let me share with you. I will stop sharing these slides, and I will try to share with you my screen. Okay, so share my screen. Window. Okay. Now, can you see this? Can you see this? I'm sharing my screen now. Can you see my screen, which include week 2 of the timetable? Do you see it?
Yes, doctor.
Okay. So the timetable has been prepared to the end of the module, but there is just one problem that we are not quite sure up to this moment that we are going to the hospitals or not. Now there are some contacts between the college and the hospital administration to finalize this. You know, in this time of Corona, there might be some restrictions in the hospital. So as soon as we get verification, then we will release to you the timetable. Otherwise, if we will not go to the hospital, then we need to change it. Okay. So the first week is the first week. Yes.
اذا ما في هوسبيتال في سيميوليشن سنتر صحيح؟
Yes. There are no hospitals. I will move to week 2 because from week 2 week 1 is separate actually is actually a special week. But from week 2 the timetable will have got a pattern. يعني حيكون عنده نمط، حيكون ماشي بنمط. تمام. So you can see here at the top left part you get the week 2, okay, and then you get TCT, then you get TCT abdominal exam. Don't worry about these abbreviations. At the end of the timetable, there is appendix which illustrates and explains all these abbreviations. TCT refers to theme of clinical teaching, and for week 2 it will be abdominal examination. What is the rationale behind assigning a specific theme, clinical theme for each week? We have observed from our last experiences that, and as you know, that clinical bedside teaching is opportunistic. What do you mean by that? You go to the hospital, you don't know which cases are there. It could be abdomen, it could be hernia, you can find a goiter, whatever. You can find many cases of abdomen, and you might not see other cases. Okay, so in order to make our teaching structured and don't miss any case, which will help us to fulfill the learning outcomes by the end of the course, we made a theme for each week. What do you mean by that theme? For example, the theme of week 2 is abdominal examination. You go to the hospital ordinarily as normal. You see the cases which are there, but you make a special emphasis on the on abdominal examination. Okay, so that by the end of that week, you had seen you would be had seen 1 or 2 or 3 cases of the abdomen. Okay, when we have a theme for each week, what is expected? That by the end of the course, you would be have seen most of the important systems. Okay, so assigning theme for each week is just to make sure that we don't miss any important case by the end of the course. Now, regarding the days, we have add colors, and these colors actually they code information, not just haphazard like that. So, for example, this light blue color indicates online sessions. You will not need to come to the campus on these days. These are either lecture, as you can see here, lecture number 7, number 8, number 9, number 10. All this will be online, and then on Wednesday, there is also another day of lectures, online day, which will end by a TBL, which again will be online. Okay, and Thursday again will be also online, in which you have 2 lectures or other activities, and then you end by this practice of physical examination skill. Again, this will be online. It's like a video assisted session moderated by one group of you. And it will not the teacher will not be talking himself, but you will be talking, and the teacher will provide feedback. This is some sort of interaction and feedback between you and the teacher, which we think is also important. So on Sunday, Wednesday, and Thursday, you will not need to come to the campus. Okay, you need to come to the campus on 2 days, Monday and Tuesday. In Monday on Tuesday, you will be in the campus from 8 in the morning to the end of the day. Okay, and here you start from 9 to 10. You start from 8 to 10 by simulation in the clinical skill labs, in the clinical skills lab. For example, you have got here what hand hygiene, scrubbing, and universal precautions. Here you will be introduced to what are the standard precautions in surgery, how do you perform hand hygiene, how do you scrub, and what are the universal precautions. Okay, this will be done in small groups, to comply with the social distancing regulations in the as outlined by the university and the health authorities in Saudi Arabia. Okay, so you'll be divided into small groups, into separate rooms, and the moderator will be moving with your rooms. He will introduce you to how do you do the skit, for example, or the procedure, and then you will practice on the mannequins, which are available in the skills lab. After that, you go to the hospital, and you stay in the hospital from 10 to the end of the day. Teaching in the hospitals will be in different premises. You can go to the ward, like for example here, group A1 will be in King Khalid Hospital. Yes, let me tell you one thing here. We have made group distributions, and I will talk about that later. We have also divided groups between hospitals. So, for example, you can see here This is KKH, it stands for King Khalid Hospital. MH stands for Military Hospital. Okay, so one group will be here, and two groups will be here, and two groups will be there. And in the next week, you swap. The group which was in the military hospital will come to King Khalid Hospital, and that was the King Khalid Hospital will go to the military hospital. You have got one session, 2 hours out of these 4 sessions. 2 hours will be in the OBD and in the ER. Now, why do you send you to the OBD, and why do you send you to the ER? I think these are very important to fulfill the objectives and the outcomes of the course. There are some cases, surgical cases, which are quite important that you will not see in the ward. You will see only in the OBD. So, for example, if you talk about lumps and bumps, like for example, a hernia, dermoid cyst, or superficial lumps, sometimes thyroid enlargement, goiter, sometimes breast lumps, okay, small lumps that can be done as day case surgery. All this you will not see in the ward because they will go to the day case unit. They will be operated and they will leave just by the end of the day. Okay. So the only way to say these cases, which are quite important to our course, is in the OBD, and that's why we send you to the OBD. But because OBDs are small settings, then what do? We try to distribute or divide the groups into smaller groups. Okay, I will talk about that. So, for example, B1 will not go as a whole. B1 will be divided into B11 and B12. One will go to the or two groups will go to usually there's more than one OBD clinic. So B11 can be in one clinic and B12 can be in another clinic, and they can swap actually in the next week, or they can continue like that. The other group will go to the ER. Why do you send it to the ER? Because all the emergency cases, again, you don't see in the ward. We want you to see the emergency presentation as it is fresh in the ER department. Okay. We have got many lectures about trauma, multiple injury patients, burns, acute abdomen, chest injuries, head injuries. Okay, all this you will see where only in the ER. When they come to the ward, if they need to be admitted, then at that time they will be operated and you will not see signs. Okay, so the only way to see signs and to be able to elicit these signs and examine those patients will be in the ER. That's why we send you once per week. We send you to the OBD and the ER to small groups, and I hope that you will commit to that and will enjoy working there. Okay. Then you have also got team-based learning session, and I will introduce you next Wednesday about that. We have also got inviting in our timetable other subjects like forensic, as you can see, forensic. This forensic L stands for forensic lecture, forensic T, which stands for forensic tutorial, and medical ethics. Actually, I don't have details about what's going to happen in these subjects. We are just inviting them in our timetable, but we don't have details about how they will teach. They will approach you and tell you about that in more detail, because I think these are ongoing sessions. They will just continue even after finishing this course. Okay. Yes. So this is the general layout. This layout will continue.
Doctor, I have a
This
question.
layout will continue to the end of the course. Yes. Yes, please.
What is the meaning of TBL?
TBL is team-based learning. TBL stands for team-based learning. This activity actually is an emerging teaching method in medicine. It has got many useful advantage. I mean, it fosters, for example, teamwork. In the future, you are expected to work in teams. You don't work alone as a physician. You work with nurses, you work with dietitians, you work with physiotherapists, and so on. And so one of the advantages is to teach you the principles of teamwork, and also it has got advantage in deepening your knowledge, because we will discuss alone and in teams, and we give feedback like that. So these methods have got many advantage and expected to deepen your learning. I will talk about that later when we come to that, inshallah. Okay. Yes, another question? Any other
السلام
question?
دكتور،
وعليكم السلام.
بالنسبة للهوسبيتال بيكون ثابت كل يوم اثنين وثلاثاء أو كل اثنين
Yes.
وثلاثاء؟ نعم ثابت. أوكي.
ثابت. يعني شوف يعني شوف الان هذا ويك 3، لما تجي الويك 4 نفس القصه.
تمام.
الاحد انت ات هوم، الاحد انت ات هوم، والخميس ات هوم. طبعا الاربعاء هنا واقع معاه الناشونال داي اللي هو يوم 23/9 واقع معاه الناشونال داي، لكن الجدول كله ماشي بنفس النسق. الجدول كله ماشي بنفس النسق. تمام. طبعا من الاسبوع الثالث يكون الساعه 8 للساعه الصبح في يوم الاحد. تمام. فبنبدا من الاسبوع الرابع كويز 1، والكويز بيكون الترناتيف، يعني كويز 1 كويزز و2 كويزز و2 اوسبيس، 2 كويزز و2 اوسبيس. الكويز طبعا حيكون في شكل مالتيبل تشويس كويشنز حوالي 30 كويشنز. تمام. في كويز 1 بيكون في around 30 questions في كويز 1 multiple choice as you used to have. بعد كده بيجي معنا في ويك 5 اوسبي 1. تمام. والاوسبي بيكون عباره عن سلايدز على السلايدز. يعني مثلا فور اكزامبل ممكن يجي لك مثلا بيشنت مثلا فور اكزامبل عنده جروين سويلنج، عنده سويلنج في الجروين. طبعا في سؤال متكرر جدا كان بيسالوه الله في المساله هذه، انه انا هل احتاج احفظ الصور اللي موجوده في الكتب او وات ايفر؟ طبعا الاجابه نو، لانه احنا نتعامل مع اناتومي، ما نتعامل مع بوبيوليشن، مع اثنيسيتي ولا بوبيوليشن. احنا نتعامل مع اناتومي، والاناتومي از كونستنت. يعني جروين سويلنج في تشاينيز ولا في سعودي ولا في any other nationality, I think it will be the same differential. So you just need to know the lumps, for example, which can be in the groin. What could it be? Differential diagnosis based on the anatomy. We'll talk about that in more details, and I will, before you go into your OSB, I will give you a rehearsal.
دكتور أحمد.
تجربة قبل ما على الأصلي، بحيث إنه تعرفوا براكتيكالي على أرض الواقع، تعيشوها تجربة يعني what's going to happen.
دكتور أحمد, I have a question.
Yes.
Will the
Yes,
quiz will be in the session or in person with the university? Written or
والله
online?
يا دكتور I will tell you about that. I will tell you about that. Most likely it will be online, most likely. لكن لو لقينا فرصة إنه to do it بالذات الأصلي لأنه الأصلي يعني ممكن يكون في difficulty. I will tell you about this details إن شاء الله. هي تبدأ في الأسبوع الرابع، وقبلها إن شاء الله من الأسبوع الجاي تكون الصورة اتضحت إن شاء الله. تمام.
شكرا يا دكتور.
اوكي طيب. طيب امشي معاكم شويه من الاسبوع الرابع. من الاسبوع الرابع بيبدا معانا يوم الخميس. As you can see here, CP is clinical presentation. CP is clinical presentation. طيب, what is the idea here? The idea here that this will, the teacher will not talk, will not teach you. Instead, you teach us. تمام. We will ask, for example, in week 4, we'll ask group A1. We will ask group A1 to go and read in depth about acute abdomen, the differential diagnosis, the etiology, the pathophysiology, everything about acute abdomen. This is your time to go and read in depth as much as you can, from wherever you want. Okay. And
نقطة بسيطة دكتور نخص هذا الجدول.
اوكي.
دكتور يوم الخميس الدكتور راح يكون اجازه. يوم الخميس راح يكون اجازه، لان اذا كان في اجازه بموافق اجازه رسميه هذه من السنه الماضيه صارت. اذا كان بينهم فالخميس يصير اجازه، نفس اللي صار السنه الماضيه.
تمام. طيب احنا مستعدين للكلام هذا. فاذا حصل اي كانسليشن لاي اكتيفيتي على طول حننتقل الى عندنا ريزيرف في نهايه الموديول. عندنا ريزيرف في تايم تيبل في شايف زي من هنا كده ريزيرف ريفيجن ريزيرف ريفيجن. عندنا هنا برضه ريزيرف ريفيجن ريزيرف ريفيجن. فعندنا سلوتس. فاي كانسليشن مثلا الخميس لو صار اجازه بننتقل مباشره لانه ما في زمن نعوض اثناء الموديول، ننتقل مباشره نعوض في نهايه الموديول. واضح؟
ممتاز ممتاز واضح جدا، شكرا.
Okay. طيب any other question؟ طيب خلينا نكمل ال clinical presentation. So we'll ask you to go and read in depth about acute abdomen for example. بعدين تجيب you read also about latest updates for example, research article, interesting research article, interesting finding in Saudi Arabia, preferably outside Saudi Arabia. Okay. Anyway, so this is your show. This is your show. You go and read from wherever you want. You prepare. We give you tips actually for preparation. You will have a moderator. And for example, in the acute abdomen, and Dr. Tilal will be moderators. Yani we'll talk to you. We'll give you general tips about what to do, how do you prepare, and so on. But بعد كده أنت you go and read about the topic in depth. You prepare it in the way that you want. بعدين you present it in the way that you want. To your colleagues who will be discussing with you. Yani your colleagues and the teachers will be talking to you, discussing with you what you are saying. Okay, so this will be interactive session. I think it is important because of 2 points. The first one will give you a chance to read in depth about the topic. So this is a very good chance to learn many information about the topic. And then the other thing that you will be introduced the skills of presentation. How do you present in front of audience, which is an important skill for doctors in general, because you will be mainly working to present your clinical findings when you graduate. So we selected big topics like capstone topics, like for example acute abdomen, just to give you room to prepare as you want. In week 5, the show will turn to group B2. They will present about benign and malignant goiter, and here are the moderators with you. In week 6, B1 will present multiple injured patient, and here are the moderators. And the last one here, there are 4. The last one is group A2. We will be talking about benign and malignant breast lumps. So as you can see, these topics are important: breast, thyroid, multiple injuries, and acute abdomen. This represents actually more than 70% of general surgery. That's why we choose these topics in order to so when we cover these topics, we will be expected to cover a large part of the regarding the TBL, on the other hand, again, the topics are capstone topics, integrated topics, which when we discuss, we also expect to cover a reasonable amount of the curriculum. So as you can see here, for example, in week 2, for example, we will talk about acute abdomen, and here there will be exercises, multiple choice questions, and scenarios, which we will work on either individually or in groups. Okay. Just 1 minute please يا شباب، لحظة بس لو سمحتوا. السلام عليكم. كيف حالك دكتور؟ اخباركم بخير ان شاء الله؟ السلام عليكم. السلام عليكم.
وعليكم السلام.
Sorry for interruption. So as you can see here, in TBL1 we'll talk about, as you can see here, in TBL1 we'll talk about acute abdomen. In TBL2 we'll talk about the sinus obstruction. In TBL3 we'll talk about multiple injuries. TBL4 about breast lumps. So as you can see, again, these are big topics that when we cover, we expect ourselves to cover a reasonable part of the curriculum. Okay. So these are the activities which will be conducted in the timetable. It's a mixture of lectures, simulation sessions, clinical presentations, video-assisted practice of physical examination skills, and so on. Okay. I think you might need in the rest of this day you might need to look at the timetable, so you know in details and you learn about it more and more. So do you have any question regarding the timetable, please? Any question regarding the timetable?
دكتور عندي سؤال واحد بخصوص الفورنسيك.
تفضل.
هل بيكون
Yes.
اونلاين او لا؟
والله I'm not sure يا دكتور.
اونلاين تواصل معي دكتور اونلاين. واليوم المحاضرات موجوده، راح يبدا الساعه 1 في الميديكال ايثكس، نص ساعه بعدها بيكمل فورنسيك والمحاضرات موجوده.
Okay. Okay. Another
شكرا.
question regarding the timetable? Any question regarding the timetable?
Thank you دكتور.
Inshallah, when you receive the timetable, you will give more look, inshallah, and you will learn more and more about it. Inshallah. Okay.
Thank you.
So, okay, let me now go to the share files. Okay. Where are we? So now we finish the timetable. And now we need to move to the other yes. So as you know, the course duration is 9 weeks. The course duration is 9 weeks from week 1 to week 8 teaching, and the last week and 9th week is assessment. So we have started today already, 30th of August, and we will finish inshallah by the 29th of October 2020. Okay. The other thing is the group distribution. Let me now talk about we have seen the timetable that group 1, they go group 1, B1, A1, A2, like that. Now we, first of all, we divided the groups, or we divided the groups based on the average grade point, on the GPA, the last GPA of the last year. Okay. In group distribution, we consider the GPA, and the idea behind that is to create groups which are homogeneous groups of academic ability. Okay, we think in the department that this is important to foster discussions, for example, and to make add some fairness to the process of group distribution itself. And from an academic point of view, it is also important. So we divided the whole class into basically into A and B, and then we divided A into A1 and A2, as you have seen in the website teaching, and then we divided further A1 into 2 groups and A2 into 2 groups. Likewise, B1 into 2 groups and B2 into 2 groups, and the further division is for the OBD and ER, because OBD is very small, does not accommodate large number of students. So if we consider that the group, there are 33 students in the class, you will get 16 and 17. A1 will be around 8, A2 will be 8, for example, or 9, and so on. And then we divided 8 into 2 groups, 4, so that they can go to the OBD. Even the number of 4 might be a big number in relation to the small size of the OBDs in the hospital. But however, we will manage to go into groups. Like, for example, if you cannot, the 4 students cannot go, then 2 can go, and then after a while they swap. Okay, this inshallah will be dealt with when we start our bedside teaching. So we maintained this distribution of A1 and A2 in the bedside teaching and for the team-based learning, so that we don't make many groups, to avoid confusing you with many groups. So we maintained the groups, the distribution, the same good distribution for bedside and for team-based learning. However, there is difference regarding the portfolio, because we are 6 teachers will be teaching this course from general surgery. So we divided the groups into 6. Each teacher will be responsible for a certain group. Okay. Now I will share my screen to show you to show you the groups distribution. To show you the groups distribution. Okay. Okay. Before I show you this group distribution, I would like just to review with you the names, because this is very important. Share screen. Chrome tab. This one is share. Okay. Can you see this now, please? Can you see your names? Can you see your names, please?
Yes, doctor. We can.
Yeah, I just want you to revise with me, please, because I'm not sure about these names. I'm not sure about how many in the class now who have passed and who did not pass like that. Sorry, excuse me.
اقول لك ابشر يعني احنا
طيب يلا ابدا معاكم واحد واحد. احمد بالله راجعوا الاسم والنمبر. If there is any fault, please correct me if there is any wrong entry. طيب احمد شيبان موجود معنا؟ احمد شيبان
موجود.
تمام. بنفس الرقم. Where is Ahmed? Do you hear me, Ahmed?
قاعد يكتب في الشات يا دكتور يقول لك نعم.
Okay. If you can't, please talk to me. No problem. If you can't, talk to me. طيب أمير سعد موجود؟
ايه موجود يا دكتور.
موجود. طيب معلوماتك صحيحة؟ تمام.
ايه موجود صحيح.
طيب مشاري عبد الله
موجود يا دكتور.
طيب عبد العزيز بن سعد. عبد العزيز هل هو موجود؟ هل حتى لو كان غايب هل هو معانا في الدفعة؟
موجود يا دكتور، موجود بالدفعة وموجود وقاعد يكتب في الشات أنا موجود. هل الرقم صحيح يا عبد العزيز؟
تمام. طيب رشيد عبد الرحمن.
الرقم صحيح.
طيب رشيد عبد الرحمن.
رشيد افتح اللي يا شباب اللي يسمع مايك ويجاوب.
ايوه بليز لو سمحتوا توك تو مي بليز. خلينا كده نحس اننا في كلاس روم.
موجود وصحيح.
تمام. علي بن يعقوب.
موجود يا دكتور، رقم صح.
تمام. عبد الرحمن مسفر. عبد الرحمن مسفر.
موجود معنا بالدفعة دكتور عبد الرحمن مسفر.
اوكي. طيب
ما هو الدوسري دكتور عبد الرحمن مسفر.
الدوسري. اوكي.
الدوسري وليس الدوس.
تمام. هذه نعدلها ان شاء الله باذن الله. اوكي. طيب عمار حاكم بن حمدان. طيب عبد الرحمن بن موسى.
دكتور بس نزل الصفحة شوي لأن مش واضحة الاسماء.
طيب عبد الرحمن بن عبد الرحمن عمار بن حاكم موجود ها؟
موجود يا دكتور.
طيب عبد الرحمن بن موسى.
الصفحة لو تنزلها يا دكتور.
انزلها كذا يعني تحت ولا ارفعها فوق؟
الاسماء بتسمعني بيكتب الاسماء اللي تحت.
الاسماء نزلها عشان نتاكد من رقم الطالب.
طيب
دكتور اخر اسم نقدر نشوفه اللي هو الدوسري، عبد الرحمن الدوسري. يا ليت تقدر تنزله عشان نشوف اللي بعده عبد الرحمن.
طيب انا الحين نزلت الليست.
ما طلع لنا شيء دكتور. لو تنزلها من اليمين اخر شيء من الصفحه نفسها.
نزلتها من الصفحه نفسها.
معلق عندك.
معلق شكله. ايوه معلق. ايوه فعلا معلق. طيب انا اقول لكم، معلش انا اقول لكم انتوا اسمعوني. طيب انتهينا. عبد الرحمن موسى موجود؟ عبد الرحمن موسى موجود؟
يا دكتور
ناصر بن ناصر موجود؟ مناسبة توزيع المجموعات، لانه